Mirroring and matching are two commonly used words in communication skills, yet there can be a lot of misunderstandings or unknowns with using them. Today, we'll be going through the different types of mirroring and matching and how you can use them appropriately with the patient in front of you. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator here in the UK. And today we are discussing mirroring or matching, as I said. Whether this is in body language or vocal tone or the words we use, they have different uses and different benefits. We're going to go through them all. And we're going to start with one everyone thinks about, which is body language. When people think about body language and mirroring and matching, we often think about two people facing each other or side by side, both looking in similar postures or positions, whether it's with their arms crossed, legs pointing in certain directions, head tilted to certain sides. We know that if we're getting on with someone and we're building a good rapport and trust, we will often start to mirror their position. You can look back, or next time you're in a conversation with someone and you feel like it's going well and you're bonding with them, if you pause them to look down how you're both sitting or standing, you'll find that you're both in similar positions. Why is this the case? Well, we often like people who are like us, whether it's things we have in common with our interests or places we grew up or places we live near. We like people who are like us or maybe share similar thoughts, etc. But of course, you can't have things in common with every person you meet. And body language mirroring is almost a subconscious way of showing that someone that you're similar to them without actually pointing out something that you may not have in common with them. And so this is why for years, this mirroring or matching with body language has been trained in various sales or relationship building or marketing and in healthcare communication skills training as well. It's not unethical to do, depending on how you're using it, but it's an easy way to build some rapport and show someone that you are similar to them, improve that likability that can then help with further parts of the assessment or the appointment. The other benefit is it takes no time to do. You don't have to say any extra words or certain things that take up extra time. You can literally do it while they're talking or you're talking to them. It takes no extra time and it will, again, have benefits. However, there are things that you need to be careful of when doing it to make sure it works appropriately and effectively. The first thing is, as you're practicing it, if it's a new thing for you, don't copy every movement that the person in front of you does, because they will then catch on what you're doing and then it can derail your relationship and they'll start wondering why you're copying every movement I'm doing. And you don't literally have to copy the movement that they do. Okay? If they were to cross their arms, let's say, then you don't have to literally cross your arms back. You can just cross your hands over, lower down. Or if they put one leg on top of the other, over their thighs, let's say, you don't have to copy that identically. You can perhaps cross your legs at the ankles. Who knows? It can be a subtle mirror. It doesn't have to be identical. And the other thing is, give it time from you changing positions. So what I mean by that is, let's say they go from not having their arms crossed to then crossing their arms. The moment you see it, don't immediately cross your arms quickly yourself, because again, it looks weird and it's obvious. Give it time, give it a good 5-10 seconds perhaps, and then do it, okay? And again, doesn't have to be identical. So instead, as I say, if they've moved, let's say we'll say a case of crossing arms or crossing legs, don't immediately copy them and rush into it. Take your time, and it doesn't have to be identical to how they've done it. You want it to look natural, not robotic. And hopefully, if you're doing it naturally and it's not looking weird, and you're building the rapport and trust and doing all the other things like you're showing interest, you're attentive listening, showing empathy, etc. If you are building that strong, firm relationship, you can also use the body language mirroring idea to see how your relationship is going. Because as I said earlier, if we are getting on with someone, they will then begin to copy us. So later in the appointment, if you want to change position, maybe let's say go from a crossed arm position to an uncrossed arm position, you can see if you do that, do they then follow you? They're probably not going to do it consciously, it'll be subconsciously, but do they do it? And it's again, it may be a sign that your relationship is there and they're liking you. It's not a guarantee, okay? And it may not be appropriate depending on what you're discussing. or how it's going. But it just gives you an idea, perhaps, that if they do mirror you, that they are feeling a strong or good therapeutic relationship with you. The final thing to say with this is, if you've been doing it with a little bit of practice, it will then begin to become subconscious. Like driving or riding a bike, when you've done it enough times, you will subconsciously do it, okay? And again, it's not going to take any extra time. It won't take any extra thinking space. You'll just do it naturally, providing you're doing it not every time and with pauses in between, so you don't look robotic and weird. So you stick to doing it naturally, and it will help build that rapport and trust with them. So that's body language mirroring or matching, which you probably have heard of before. The next type is language mirroring or matching. And that is where we're using similar words or phrases to what the person in front of you uses. So when we think about language mirroring or matching, the first example would be using the words that someone uses back to them. Now this has two benefits. So firstly, you can use it for showing that you've heard and then trying to understand or keeping them involved in the discussion. So not all patients who come to see us, for example, will say pain. They may say ache or discomfort or stiff. So rather than sticking to the conventional pain, let's say if I'm seeing George for his osteoarthritis, George may not complain about pain. He may have this stiffness and discomfort in his knee. So I'm going to ask him questions about his stiffness and what makes his discomfort worse. And when we come to explaining about his condition later, I might say, well, George, your discomfort here is because of X, Y, Z, or you're feeling stiff because of this. I'm using his words back to him, so I'm being relatable. It's easier for him to understand and to relate to what I'm saying. On the flip side, you can also use their words back to them to help get more information. So Chris Voss, who writes Never Split the Difference, he'll use mirroring with words to help someone get more information out of them. So let's say the patient in front of you has said, it's been a really tough time. I don't know where to turn. I'm really struggling. And you might say, really struggling? And they may say, well, yeah, because I'm not getting any financial help. My husband's left me. I'm having to deal with all the kids, etc. So you've got more information there, okay, just from repeating the last couple of words in that case back to them. The key thing with this is to use the inquisitive tone as you do it, the inflecting up. So you could say, really struggling, right? If you use the up tone, the more likely to then come back to you. If I said, really struggling, they've probably just gone, yeah. So the key thing with using their words back to them to get more information is that you have the inflect up at the end. And again, it's another way, if you've used lots of open questions, but you want to get more information still, you can just repeat those last few 2 or 3 words to then hopefully get more info. It's not a guarantee, but you'll just get more than just a yes or a no. Another important part of using their language is when you're explaining things. We want to explain it at their level. Now, for most people, this will be at the kind of secondary school, kind of teenagery level, because most people don't go into healthcare, medicine, whatever, okay? They don't know the Latin terms for things or what they mean. So we can use basic words that hopefully anyone can relate to. For example, people won't know what patella means, but they'll know kneecap. Or they may not know meniscus, but they'll know cartilage. We're just going to use the words that they'll have heard already every day. It's easier for them to relate to and understand what we're saying, and therefore easier for them to process and understand as a result. For example, I've had people come in to see me who've done lots of reading in advance, lots of scientific reading. They seem to have grasped the idea of nociceptors and nerve roots and certain pain aspects. And I can come back and I can use those words with them, okay? Because I'm using their language. I'm trying to bring them on board. And sometimes when you have someone who's a bit more understanding of those terms, you don't want to dumb it down too much because they might feel that you're not taking them into account. You're not trying to understand them or their needs and their learning point. So in a way, if you can, and you feel you should use more technical language, if it feels appropriate, then do. Of course, the majority of people won't be at that level. So for the majority of people, you are going to use your layman's terms, your basic language that they would have heard every day. And finally, we have emotional mirroring or matching. And this is where the tone of the conversation you're trying to be in a similar range to. And let me give you an example. I remember seeing a lady in her early 20s. We'll call her Jess. And Jess has widespread pain everywhere. And Jess had been coming in to see me, but she was very upset, very quiet, very slow in her talking. She had a lot of stresses in life that were impacting on her situation. She was crying because it was a difficult time. Now, if I'd have come in and I'd been like, Jess, it's okay, we're going to get you moving or get you going, what would that have achieved? Okay, nothing. I'd have shown her that she's upset, but I'm not meeting her where she's at. So what did I do? Simple. You quiet down, slow down to their level. Now, we have to be careful with these people. We don't go to extremes, because if someone's really emotional, whatever extreme they're at, we don't want to enforce that further. Like I said last week with angry people. Okay, if someone's getting angry, you're not going to get angrier and shoutier back at them because you're going to exacerbate that further. Someone who's sad, depressed, and quiet, you don't want to get too quiet. For A, if no one says anything, it's not a conversation. But we want to be there for some support. We want to show we're with them. And if we're talking too quietly, obviously they won't be able to hear us. And then as it feels appropriate, if you want to try and bring up the emotions a bit, you can try. Or if someone's really angry or higher level energy, if you want to try and bring them down and gradually slow down your voice, you can. But meeting them where they're at with a matching or mirroring emotion is really important for helping them feel that you are empathetic towards them. You're trying to understand their experience. That's probably the most important of the three, because you can sit in certain ways, you can use certain words, but your tone and how you are is probably the biggest thing they're going to take away, and how you make them feel. And if they can feel supported, they can feel that you understand, that will make the biggest impact, make them more likely to understand what you're saying and hopefully buy into what you're suggesting. Remember, these are all fine tools to use that are already taught in various communication skills training. They are ethical, providing you use them appropriately for the benefit of the patient, not for yourself. If you found this useful, as always, please do share it with others. Please do contact me at BYbrowPhysio on whatever social media you're on. Please do send me any questions, guests to get, things to cover. As always, I hope you found it useful, and I look forward to speaking to you next time.